You work, you get paid. Except for the second time in a few months, we've heard from Medicaid providers who serve some of the state's most vulnerable to say that they're working and not getting paid for it. So for the second time in a few months, our Marshall Zellinger is following the money.
Email inboxes can be, well, overwhelming.
I wake up and get 30 denials in my inbox.
There's no denying the inbox for Counselor Sybil Cummin is a bit more frustrating.
I received an email today stating that they have not fixed the problem and that they're not sure how long it will take for me to get paid.
Cummin's practice works with a lot of children from foster care. The Medicaid denials she's receiving are for legit services. CCHA, Colorado Community Health Alliance, which handles Medicaid for these 8 counties, had an issue this month paying counselors for specific services. For instance, a 30-minute appointment. The Client Services Director for CCHA tells me it was a 10-day system issue that is now resolved with claims being reprocessed.
I have actually had to look into maybe getting a small business loan so that I can continue to cover payroll and cover health insurance for my team. This is actually the first year I have ever thought about ending my contract with Medicaid.
No money. This latest round has been since the end of January.
This is the second time Carla D'Agostino-Vigil has dealt with claims issues with CCHA. Late last year, CCHA sought reimbursement from 199 counselors for services the therapists said they provided, but CCHA could not verify. After coverage by us and the Colorado Sun, CCHA stopped seeking the money back.
We serve those that are struggling with obsessive compulsive disorder, trauma and PTSD, and substance use disorders are our specialties.
In October last year, D'Agostino-Vigil gave CCHA 6 months' notice that she was no longer going to serve its Medicaid clients. CCHA wants her to reconsider. At the same time, she's waiting for payment.
My team and I are not accepting new Medicaid clients. Our most vulnerable are going without adequate care.
Both counselors in the story signed a letter sent to state lawmakers and the state's healthcare policy office asking for a no-interest loan fund to bridge the gap when issues like this happen. The Client Services Director for CCHA tells me these claims are being processed and that they're still considered on-time payments if they're made within 30 days.
This goes beyond just people getting paid for the work they do, because if they opt out of this system, there's a whole bunch of folks who could be in a world of hurt.
D'Agostino-Vigil told me, for example, for OCD clients, if she leaves, another option is UC Health, which she got an email saying UC Health has a months-long backlog. And so if that's the provider and there's no other providers, you're either waiting for the services or you're not seeking the services.
Yeah. All right. Well, we're glad that you're on it. Marshall Zellinger looking downright professorial today. Thank you, Marshall.